Welcome back, class. We're going to kind of crawl through this second segment and talk about public goods. And two things that always remember about public goods. They are non-rival, which means many can enjoy without diminishing the experiences of others. And they are non-excludable. If available for one person, hard to keep others from enjoying it also. Think about when's the last time you went to your local community's 4th of July fireworks display? That's considered a public good. It's non-rival and it's non-excludable. State parks, national parks, unless there is a usage fee or an entry fee, you've got free riders that come in and enjoy the parks. They again, non-rival and non-excludable. Public schools, typically the only parameter to sending your child to a public school in a certain school district is you either have to live in that school district or you get some kind of a waiver from the school district itself. Sidewalks, street lights, city streets, all of those are public goods. And again, public goods you can enjoy without paying for it, and that's where you end up with a free rider. Firms don't receive a true picture of the benefits of public goods, and they usually end up producing too many as a result. It's difficult for a firm to actually figure out the marginal benefit, and so it's difficult to set marginal benefit equals to marginal cost, or marginal revenue equals to marginal cost, however you want to set up your formula. And also because you can't get to that point, it's hard to really maximize benefits for a firm that's in the private sector. Public goods either produced by government agencies or they're outsourced to private companies. You're starting to see more and more let's just take the prison system. Outsourcing to private companies because either state or federal governments have decided that a private company can do it more effectively and more not only cost effectively, but more efficiently than the government itself can do in that state or whether it's a federal government. Public schools versus charter schools. And this has become a real issue, especially with the teachers' unions. Oh, they are just up in arms that they're blaming everybody and their brother that it was their fault that school systems have fallen behind with with the effects of COVID. And it was this teachers unions that appeared to be the drivers of keeping kids home. So you're going to have and a lot of the friends that any of the friends we have or co-workers that I had in Buffalo, they are sending their kids to parochial schools or sending their kids to charter schools because they feel like they get a better education. Some individuals that I worked with in Buffalo had a work schedule that allowed them, either them or their partner, typically husband and wife, to have work schedules so that they could homeschool their kids because they felt like that homeschooling was a better overall education than they were getting in the public schools in Buffalo. And the last point that they make is taxes generate public goods. And public at that point it becomes a publicly provided good. So using tax revenues to generate that public good. And as they talk about in the text, you don't pay your taxes and you get caught. It's that all expense, paid vacation to Leavenworth. And trust me, I've been in the area there in Leavenworth, Kansas, and it's just like one prison after the other. And if you get sent to Leavenworth, I can't imagine it would ever be a very personally rewarding experience to go to the federal pen in Leavenworth. Actually knew an individual that was stationed on base there at Fort Leavenworth, and some of the stories pretty unique. And when we get to public goods, you're looking at external costs and benefits. Some goods are special because their production creates costs that are borne by others not directly involved in the production or the consumption of the good. They give an example in the text of a living next to a fish cannery. And evidently in Monterey, California, one time there were a lot of fish canneries, and the smell was pretty oppressive. I provided an example earlier, I guess in segment one, when I was talking about just the air pollution that kind of settles over kind of that Los Angeles basin, moves out to San Bernardino, Riverside counties. And sometimes you can, if you're in that area, it is oppressive just to see that. Social cost, and they defined it in the text as the private cost of producing a good or service plus the external cost of producing. So that's the cost to society. If you're looking at, if you talk to your accountant is going to talk to you about the cost of producing the good or service that your firm produces for society. But the societal cost is the actual cost of the production process plus the external cost of producing that output. Now compare that to the social benefit. The private benefit of a good is revealed in the market, plus and it's the external benefit. So you've got the benefit, and again, go back to the text where they talk about baking bread. The societal benefit is the bread that baker is producing, which you can purchase in the marketplace, and then you have the additional benefit. If you're walking down the street on your way to work, passing a bakery, you have the smell of the bread waffling out, and that is your external benefit, and it's the benefit of the purchase of a loaf of bread plus the smell of the bread as you go by gets you to the social benefit of the baker generating loaves of bread to sell to the consuming public. And then they provide you with an example or a formula in the text that says society needs to maximize its well-being. And we've talked about that in multiple chapters in the past in this text. And we've always talked about the marginal benefit equal to marginal cost. But from a societal perspective, or the perspective of society, you're talking about the society's marginal cost equal to society's marginal benefit. So you're taking the two and setting them together equal. And at that point, you're going to maximize society's well-being. If an activity generates external cost, society ends up with too much of it. Again, think about air pollution. Think about the fish cannery. You're going to end up with too much of it. Ways to get around it is you can tax the production. If the tax equals to the external cost, then the producer considers both the private cost and the external cost in their production, that their production basically imposes on not only you, but others that are in the area or in the environmental space that is being impacted. Production will decrease to society's ideal level if you input or if you implement a tax to generate revenue from not only generate revenue, but to decrease the external cost from that particular production process. And then again, it goes back to the text, and it talks about baker baking the bread gets buyers to pay for the smell of the baked bread. Government subsidize bread production if the subsidy equals the amount of external benefit created by each loaf. The baker will produce a socially ideal amount. So I don't want to say to force, to incentivize bakers or any firm that is generating a external benefit, you can subsidize them to incentivize them to generate a socially ideal amount. The flip side of that is a firm that is generating external cost. You can tax them at the level equal to the internal cost, and that will drive that firm to generate a production process to a level of output that is the socially ideal amount. And at some point, when you're incentivizing them, you're trying to provide a level of dollars equal to a firm. Go back to the bakery, you're essentially saying that the government is paying for the consumer's level of enjoyment of the smell of the bread that's waffling out of the bakery. And at that point, the authors start to move into imperfect competition. They set their, as we've talked about in earlier chapters, they set their prices greater than marginal cost, their opportunity losses, consumers willing to pay the full cost of resources embedded in a product end up being priced out of the market. So you've got the money you're willing to pay, but it's at a price that prices you out of the market. Produce less of a good and price more than the ideal from a socially acceptable standpoint. Reduce monopoly power and reduce prices. And that is where the government policy, regulation, and laws try to step in. They try to reduce monopoly power. They try to increase the quantity produced and reduce the prices that are passed on to a consuming public. So, and we talked about that when we were talking about both monopolies and imperfect competition. Assessing government responses to market failure. And as I said, you've got within the public policy environment, especially in DC and also at a state level, it's not just federal, but at a state level too. You've got some level of economic thought that is driving that. Economists over time have developed models to estimate or assess market failure in particular market economies. And these are the type of models that policymakers are going to use to develop the policies, the regulations, the laws that they are going to try to pass and or implement in such a way as to eliminate or at least to mitigate the impact of market failure on society. Markets fail to achieve efficiency, and that is the result that governments are focusing on. Those markets that are settling so that the equilibrium price and quantity settles at an inefficient point or an inefficient result. Potential gain and the deadweight loss, you're talking about limiting, you're either talking about limiting or completely doing away with the deadweight loss. Eliminate the well-being left on the table. I mean, all of this, your terminology that you see in the public policy sector. And you can do this by per unit tax, again, equal to the external cost. Again, goes back to external benefit, external cost. You can also do it with the government subsidy on the external benefit side of the house. You can either, attack these by breaking up the monopoly or setting a price ceiling. Think about what we had in the rent control in the earlier chapters, talking about rent controls in certain cities, setting a ceiling so that at least in the government's mindset, that's price ceiling is going to allow individuals that are less financially able to pay the market level of the rent, of the price of rent. And it's going to allow them to get into some of these rent-controlled apartments and provide them a better life. And that is the goal of government policy or public policy. And as we said in the earlier chapters, it doesn't always work that way. So if you're trying to eliminate the well-being that's left on the table, that's where you end up with a public good. The per unit tax, and again, I talked about on the external costs, the government subsidy, we're going back to the external benefit, and breaking up the monopoly, you're trying to break up not only monopoly, but imperfect competition. Again, we talked about monopoly, we talked about monopolistic competition, we talked about oligopolies. And those are what public policy is focused on and trying to break up so that they can drive those markets either back to perfect competition or drive the markets in such a way that they can maximize the net benefit to the public sector. Issues with government intervention, and they go into somewhat detail on this in the text. Policy officials may lack relevant information, which implies they're missing facts. And as efficient and as accurate as economic models are only as good as the information that is being fed into these models. Governments fail to achieve the socially optimal prices and quantities unless they know the facts and implement the perfect policy. And I am somewhat, as you can probably tell, I'm somewhat leery when it comes to the ability of the government to implement public policy that's going to make society as well off as kind of Adam Smith's invisible hand. But there are some public policies that do a fairly decent job in trying to move society to maximizing net benefits. Unfortunately, there is no perfect policy. All of them have flaws. Think back when we talked about price floors, price ceilings, the allocation of public goods, income transfers. There is no perfect public policy. Choice between government intervention and the market forces is always a choice between imperfect alternatives. You're looking at, do you move forward with government intervention and allow the individuals that are in DC supposedly leading us forward, or do you allow the invisible hand of the market forces within the market economy to move the economy to a not only an efficient level but an equitable level? And at the end of the day, I agree with the authors. You're talking about imperfect alternatives. There is no perfect alternatives. Government policy is inefficient. It's imperfect. Market competition can be inefficient and imperfect. So there is no perfect alternative. And then the authors kind of start to segue in at that point, and they start talking about influencing irrational behavior. You can impose on social outcomes by altering irrational behavior. Behavioral economics is an area of economics that draws on psychology, neuroscience to understand how and why individuals make decisions. And in general, it may work, but you probably in a general economy for any country, I'm not sure it's a normal distribution. It may be skewed to one end of the tail or another end of the tail, depending on what country you're talking about. Incomplete information or incomplete processing of available information. And that is the issue with the individual decision-making process. We either have, as an individual, and I'm as guilty as anybody, I either have imperfect information or I don't know how to incorporate the information into a decision-making process that doesn't generate an imperfect solution. Again, economists are constantly studying choice, and the choice again. We go back, and it's subject to the three pillars of economic thought, and that's what separates us from other social sciences. It's opportunity cost, it's self-interest, it's decision making at the margin. And no matter how much information we have as an individual, we're going to end up, the probability is we're probably going to be more incorrect than we are correct in making our decisions. Individuals may be rational, but their rationality is bounded, keeps them from maximizing utilities. And I think to a certain extent, the authors point out a very valid point. We may be rational, but we have parameters that constrict us from making decisions that are going to maximize our utility. Governments can structure laws, rules, and regulations to nudge consumers to make better decisions. At least the government thinks so. Go back to tobacco industry. Laws, regulations, excise taxes on cigarettes. The government is trying to nudge consumers into making choices that are going to maximize their health status in that situation. Same thing with drugs and narcotics and alcohol. Governments are trying to implement laws, regulations, policies that are going to drive us as individuals, and the collective us as individuals, going to drive us toward a decision process that allows us to make more prudent decisions that at least the government, and to some extent, you have to agree with the government on this one, that is going to nudge us in the direction of making decisions that could maximize the number of years that we live, or could maximize the health status that we're all trying to, at least a level of health status that we're all trying to achieve. Everyone faces a similar set of choices, but restructuring those choices nudges consumers to make better decisions. And there they're talking about 401k elections. And so you go to work for a company, and every company that I've worked for has a 401k opportunity. So you put aside money in 401ks, and the government matches it up to like 4 or 5%, up to a certain level. So, and by matching it from a financial perspective, it tends to nudge individuals toward allocating some of their paycheck toward 401k or to IRAs or to some kind of a similar type of financial arrangement that nudges individuals to start saving dollars toward retirement. So at that point, the government doesn't have to step in and fully support those individuals when they retire. So the government provides tax breaks for individuals as they allocate $401 out of their paycheck to their 401k. And then the government, the text jumps in and kind of moves now to a redistribution or redistributing of income. And private markets' ability to efficiently allocate resources depends on the initial distribution of income. And that is a kind of not only a supply and demand model, but it's a model that a lot of public policy is built upon. Desirable versus undesirable allocation of resources depends on income distribution. So depending on the income distribution, firms are going to allocate resources based on the income distribution of that population that they are trying to produce goods and services for. Incomes people earn are, somewhat, part due to luck. And to a certain extent, it is part due to luck. You win the lottery, you have an inheritance from a relative that leaves you significant dollars. You may happen to be at the right place at the right time, maybe in the right geographical area of the United States to grab that really high-paying job, or you may have been born with some type of a hereditary mindset that allows you to be the next great entrepreneur, or the next great programmer that's going to make a bazillion dollars programming AI code. There's just a lot of luck that draws that income. There's also shifts in supply and demand that alters values and incomes that the market assigns to particular skills. And again, this goes back to AI. If AI is, you're hearing these ridiculous salaries that they are paying individuals that are adept at coding and writing code and programming, because they're going to be the type of skilled labor force that they're going to need to drive AI forward. And then you have people that really care about others. Charities and support for government programs to redistribute income. Everybody that files income taxes, they have the ability to get a tax write-off for charitable deductions. A lot of people, because of the level of deductions, either a single individual, I think it's 12,500 maybe, or somewhere along there, and a married couple is 25,000. You can get those exempt amounts, but if you're a single individual and you've got charitable deductions that are approaching 15,000, 20,000, whatever, it actually behooves you to donate to charity, because you're going to turn around and get a tax break going forward. So, and then the tax, kind of before they get into kind of how the government finances, they throw a couple of other things out that says, if a public program or public good provides a safety net and assurance that people down on their luck will fall too far, then society may be better off. So now you're talking about governments providing safety nets, or individuals that in the back of their mind, individuals know that I can try and fail, and that's okay, because there's going to be a safety net here. It may improve entrepreneurial opportunities. It may improve maximizing the net benefit of society. But a lot of individuals in the United States especially depend on that safety net. Programs to redistribute incomes can be divided into basically two categories. Means-tested transfer payments, and the transfer payments for which the recipient qualifies on the basis of income. You've got Medicaid for healthcare services. You've got Social Security, because if you're an elderly population, let's back up. So you've got Medicaid for kind of the low-income individuals. You've got in the Social Security program, you've got what they consider a dual eligible. So you're eligible for Social Security because of your age, and you're eligible for Medicare because of the income level. So if you're dual eligible, you can receive income transfers and healthcare services from both programs. You've got SNAP, you've got there's one called TANF, you've got WIC. It's women, infants, and children, and that's a food-based program for pregnant women and young children. That's why it's called WIC, women, infants, and children, and it's basically providing subsidy payments for, and it's been a while since I've studied it, but I think it's based on like dairy products and eggs and things that pregnant women need to ensure that they have a healthy child born, and then food products that are going to be beneficial for young children, especially at younger ages when they're trying to develop and grow and meet their skeletal needs. So, and then a lot of these dollars Used to be food stamps. It was actually a stamp. You would see people go to the grocery and, they're pulling these stamps, and the stamps, I don't remember, seemed like they were in financial denominations. And I don't remember the denominations, maybe at $5, $10, $20 denominations. Now everything is on these electronic benefit transfer cards, these EBT cards. And as I said earlier in one of I guess it was in this first segment tonight, money's just on a quarterly basis loaded on these or on a monthly basis loaded on these EBT cards. They go to the grocery, they swipe them, and it's just like using a Visa prepaid card. And then there's non-means, tested transfer payments for which income is not a qualifying factor. Medicare, Social Security, unemployment, aid to farmers. This is not based on income. Unemployment, I think now it's a certain percentage, and it is capped in each state, and you may be able to get unemployment for like 18 months or 2 years. I don't know. I've never filed for unemployment, so I don't know the parameters. But Medicare, I think you hit 65 years of age, and at that point you automatically get Part A, which is your hospital part. You can sign up for a Medicare Advantage plan. The government still, when you start collecting Social Security, they're going to charge you a premium for Part B, which is your medical or your physician services, unless you live in certain zip codes. Part C is kind of the managed care part of Medicare, and then Part D is the prescription part, and there's some other parts that are not too well known and probably not overly utilized, but it's usually A, hospital, B, physician type services, C is kind of the managed care part of Medicare, and Part D is your prescription piece. So that's kind of wind us up on the income transfer part. And we're going to come back and talk about just how we finance the government in the third segment. Talk to you in a few minutes.